morning, good afternoon, and good evening to all the participants in this webinar today. I'm Dr. Purnima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India. On behalf of the hosts, our center, the Health and Environment Leadership Platform at the Center for Chronic Disease Control and Healthcare Without Harm, it's my privilege to extend a warm welcome to all the panelists and the participants to this important discussion this afternoon. So the theme of the webinar today is the management of waste in the COVID era. So all of us recognize we are living in extremely difficult times. The pandemic has been around for almost 6 months now in some parts of the world, and it has impacts across various domains of health, economy, as well as the social fabric of different geographies around the world. Yesterday we celebrated World Environment Day, and at one other webinar we were discussing what has the impact of the pandemic on the environment. Like if we were to think of it as the good, the bad, and the ugly, the good is pretty evident. We all recognize that the lockdown situation has helped to rejuvenate nature, and we are seeing air that is cleaner and easier to breathe. The water bodies are looking more pristine with all the industrial effluents and all being shut down. But the ugly part for me has been, of course, the crumbling of the social fabric and the risks of the hordes of migrants crisscrossing across the country will be with us for years to come. I was thinking of what the bad part was for me, and I think the bad probably is sometimes, I think despite us being fortunate enough in India to have very comprehensive waste management rules, whether that's for the solid waste management, for the healthcare waste management, the biomedical waste management rules, as well as the guidelines that the CPCB, the regulatory body, came up with so quickly, for the COVID waste as well. There has been some concerns raised and some confusion on how waste has to be managed, not just in terms of the solid waste management. It has crumbled in many of the resident welfare associations have been talking about it, raising concerns that the whole life cycle of waste management has crumbled for so many reasons. The lockdown has prevented the waste collectors, the handlers. So when we're talking about the healthcare facilities, there have been various other forms of concerns that have been raised. And the quarantine centers, the isolation wards in hospitals, all of these have seen different challenges in waste management. So we thought it was very apt to bring together some experts from all the different domains to provide not just national, but international perspectives as well on COVID waste management, the key challenges, the key opportunities that we have to improve upon the way we are handling our waste. So this webinar today will have perspectives from different domain experts, and we will follow that up with a panel discussion, and then we will take questions from the audience. I'm sure there will be lots of queries from the audience on different aspects, whether that's healthcare facilities or the solid waste management. And I will hand over now to my colleague, Ms. Ananya Tiwari, Senior Research Associate at the Center for Chronic Disease Control, to introduce the speakers and move us on in the agenda this afternoon. Ananya, over to you.
Thank you, Dr. Purnima. Good evening, everyone. My name is Ananya Tiwari, and I work with Dr. Purnima. I welcome all of you to this webinar on waste management in the era of COVID-19, which aims at highlighting some very important aspects around waste management during the current pandemic. Beginning with our first segment of the webinar, I would like to introduce our first speaker, Ms. Stringer. Ms. Stringer is the International Science and Policy Coordinator for Healthcare Without Harm. She coordinates their work on waste and also provides expertise in chemical, pharmaceuticals, and procurement. She's a member of the International Solid Waste Association Healthcare Waste Working Group and advises on waste management policies internationally. Today, she will be presenting on international perspectives
Thank you very much, Ananya, and thank you for the opportunity to speak today. You just give me a second. I think I can share my screen. I hope everyone can see the screen correctly. Ananya, is that okay?
Yeah, now it's fine. Yeah.
Lovely. Okay, now my, excuse me one second. I just need to have some small adjustments here. Okay, fantastic. So thank you very much for the introduction. There we go. And I'm going to move straight on with the presentation. So as I said, I'm going to give the international perspective on how to deal with waste from healthcare facilities during the coronavirus. In some respect, the international guidance differs from the guidance which is given from India, because globally, the advice that we've given is that you simply need to adhere to your existing system. If your system can cope with the waste during the ordinary days, then we should be able to do it in this term as well. And the fact that India has given specific guidance for coronavirus is actually, it teaches us lessons globally, because I think some of the changes that have been made highlight areas in the system where people feel that they may need to be reinforcement. And so we can take this as a lesson and a reminder of not only what is important about the systems, but where we can have a longer term reinforcements that will give us a system that will work not only in coronavirus, but in the long term and in case of some other disaster that befalls us, be it a cyclone or a disease outbreak or so on. So this is a very important thing to do. Okay, next slide. So the sources of waste are going to be just the same as normal, from potentially infectious patients and the staff caring for them. And this is going to, of course, it's including a lot more PPE. Medical labs will be processing a lot of samples, no change there. In the community, establishments like shops will not normally generate potentially infectious, may be doing so because staff are wearing PPE. And then people are self-isolating at home with mild illness will generate potentially infectious waste, such as used tissues. But as well as the source of waste, we need to ask ourselves, how might this waste spread the infection? All the research we have points to two ways which can be spread, from infected people and from contaminated surfaces. There is no evidence yet that surface contamination is re-aerosolized. So as long as everyone is handling waste, wears the usual PPE, protect them from direct contamination, and maintains good hygiene, there should be no extra danger. But people are also concerned about things like food waste, and we're hearing they want to put into the yellow bag for incineration or use throwaway plates. And there's no need to know this. And I know that other experts on this panel have been advising against it. But there's a lesson here, is that people that are generating the waste on the wards need more advice and reassurance about this. And so we need to have proper training and refresher training, so that people are confident in how they're handling waste. And this is something that should be done universally and strengthened universally. There we go. Management of waste at source then. So the international group's most important message for healthcare waste is that the best practice needs to be maintained and reinforced. Waste from known coronavirus measures may need to be classified as infectious, but other than that, just keep your normal segregation system. We also advise against expanding the definition of waste which are infectious, and there is no need to classify as highly infectious. The worst problem I've heard of, apart from the problems where places don't already have segregation, is places like Italy, which classified all waste from hospitals as treating coronavirus as infectious and overwhelmed a perfectly functional system. And the advice to cut masks and PPE, which has been in place in India for a long time, and it isn't in place in other places, because we know that there is illicit recycling of medical waste. So we need to shut these down. There's already, action on this, but it's not enough. There are people that are at risk every day of the year from illicitly recycled medical waste. And it's not just because of coronavirus, but because of hepatitis, TB, HIV, and all the other diseases that can be spread this way. To protect our healthcare workers, this is absolutely vital. They should have the standard personal protective equipment. They should have dedicated boots or shoes, a waterproof apron or long-sleeve gown, face protection, so some mask, goggles, or face shield. They don't need the N95 or FFP2 mask because they should not be exposed to aerosols in the same way as healthcare workers. But they do need to be protected from splashes, including splashes to the eyes. And so the goggles, mask, and face shields can also deter them from touching their faces. They need to be trained on how to put on and remove the PPE. It's not done the right way. They're at risk of infecting themselves. And also they to perform hand hygiene after removing PPE. And I see too many places where they don't have the correct PPE, or they don't have, places to do hand hygiene. So not just for coronavirus, long term, we need to make sure that they have access to the right equipment, that they are properly trained in how to use it, and that they have all of the hygiene facilities that they need. They also need to be protected against other diseases where they're outsourced or where workers are not full employees of the hospital. They may not be offered the same vaccinations as healthcare workers have. So they need to be protected against HIV, hepatitis, tetanus, free of charge and routinely. Transportation and storage. We know how to do this, right? Collect waste once a day, maintain segregation, use a wheeled bin, and so on. And some places, India included, are recommending it's double bagging. That shouldn't be necessary. If you've got a good strong bag and it's placed into a leak-proof container and wheeled away, and then this leak-proof container is, transferred into the vehicle and that goes on, there's no need for double bagging. So the message about double bagging tells us that we have a fear that the weaknesses in the transportation system. So let's reinforce those. Let's make sure that the trolleys are there. So many places I go where you see that the waste worker is simply carrying the bag in their hands, which is opening them to, there may be dripping from it. They may be getting needle sticks from the bag. We need to have a better system for this. Then when we come to treatment, there are, here we have this is from KGMU, this very nice autoclaving system. This is the sort of system that many hospitals can have if there isn't a centralized weak treatment facility available. So the global advice from the Stockholm Convention and from the World Health Organization is that we need to be avoiding incineration. We need to be using alternatives like steam-based disinfection. And yet during coronavirus, we're seeing people saying, well, we need to incinerate more. This is exactly the wrong way for us to react during this. WHO and the international waste management community is advising for no regrets investment. So don't put in place anything that you don't want to do in the longer term. So if more waste needs to be treated, then we may need to have, better capacity for autoclaving. We may have better staff to be able to put on shifts. But what we mustn't do is start moving towards incineration. We mustn't start using disposables like so on that are unnecessary and that do not, in fact, give us a proper any extra safety. There's no. A disposable plate is not safer than an ordinary steel one. be washed properly. Maybe the investment needs to be in washing machines for the kitchen. That's an investment that we will not regret. But if we start moving to disposables, then we will. Okay. Then lastly, I just want to talk briefly about in the environment, in the community environment. And here we find that, we're getting more PPE, and people are worried about whether stuff that's coming from the household needs to be treated as infectious waste. The international guidance is that waste from households should continue to be treated in the same way before, and not as biomedical waste. The chance of this waste containing coronavirus is low, and as with so we need to advise people not to disinfect waste. But if you're disposing that or other PPE, cut so that we can prevent rag pickers collecting them for reuse, and always to wash your hands after handling masks or other waste. And Public Health England advises that if waste from people at home with mild symptoms is held for 3 days before being put out for collection, it'll reduce the viral load so that it's treated like municipal waste without risk. And as I'll talk a little bit more later about the need for municipal waste handlers to have the proper protection as well. But for now, that's my presentation, and thank you very much for listening.
Thank you, Ruth, for this interesting presentation. Moving on to our second speaker, I would like to now introduce Dr. Shamla Mani. Dr. Mani is a consultant with the Center for Environmental Health. She has 35 years of experience in the field of education and policy, and has contributed to the formulation of several waste management regulations in the country. She's been actively involved in the projects and capacity building of urban local bodies under Swachh Bharat mission, and is also the team lead of waste management exposure workshop. She will be presenting on role of IEC in capacity building in improving biomedical waste management. Ma'am, over to you.
Thank you so much, Ananya, and good afternoon to everybody. So I'm going to be speaking on the role of information, education, communication, and capacity building in improving biomedical waste, especially during COVID. But to tell you the truth at all times. So I won't dwell too much on this. Everybody knows about it, the SARS-CoV-2. Like Dr. Malini has been telling us and Ruth just mentioned, it's not a hemorrhagic virus, and it is with lipid coat. So that's what we really need to keep in mind for waste management. Just now, I just checked with the television, and it says that we have crossed 236,770 cases. We have crossed the cases in Italy. So we are number 6 now in the world. The deaths are low because it's demographically a young country, and also a lot of recovery is happening. And thanks to all our COVID warriors and our doctors and all microbiologists who have helped us. Like Dr. Purnima mentioned, there have been some good effects of corona, that air and water and environment has improved. But this is the new normal, people working from home, and everybody has been advised wearing face covers, what they are called now, instead of being called as masks. And this clearly shows that with or without mask, definitely the viral load and the aerosols in the environment are much less. So even the WHO's advisory today very clearly says that, of course, mask alone is not enough, but it is important in wherever you go out. So the most important thing is that in spite of all the checking and testing, a lot of PPE is being generated. Now this person is also sometimes wearing PPE, but at least definitely gloves and masks. The status of biomedical waste, like we already know that the bedded hospitals are almost 1 lakh, and the non-bedded all-inclusive is about over 2 lakhs. That is 200,000. And we also have 559, about 600 tons every day. But this is now doubled during COVID time. And also there is violations, which Ruth mentioned, which is being addressed by the CPCB. Yutika will talk about it. We have over 200 common biomedical waste facilities, which are trying to address this entire biomedical waste issues. And of course, there are captive biomedical waste treatment facilities in hospitals, which are not being able to be connected to the common biomedical waste. Sorry. So the categories are, as you already know, yellow, red, white, and blue. Yellow is the incinerable, which has got the anatomical and the microbiological and the pathological. Red is most of the one-time plastics, mostly, and they can be autoclaved. And white is the metal sharps, and the blue is the glass, whether it's broken or unbroken. So normally, this is what we have seen in a hospital, that over 70% is general waste or uninfected waste. And this is the approximate percentage that we found of yellow, red, and this is blue and white together, sharps. And this is what has been followed even before COVID. That is, the general waste is separated. Sharps are either disinfected or autoclaved and recycled. And infectious waste, here all the anatomical waste in remote areas, it can go for deep burial, but otherwise it goes for incineration. And this autoclave is basically for the blood bag and vacutainers or something, then they can go into for incineration. Chemical liquid, if you have the Karnataka model, the wash basin model, you can disinfect it then and there. That is for the liquid waste, chemical waste. All the solids, some of it goes for incineration and some of it is returned to the manufacturers, or it has to go for deep burial. All radioactive waste goes to bark. And then you can see that the treatment of liquid common effluent treatment is now absolutely mandatory in ETPs, and the sludge can go to TSDF. Infected plastics, again, except the blood bag, which goes for autoclaving and then incineration, everything else goes for autoclaving or hydroclaving and shredding and washing, and then it is recycled. So this is what the CPCB has said about biomedical, general and other waste, including e-waste, as to what are the kind of things that need to be done at the hospital and also at the common biomedical waste facilities. These are the special guidelines which Ruth mentioned. Of course, the double-layered bag has been specifically mentioned because in India, some of the bags have been found to be rather flimsy and there have been instances of breakage. So I think to prevent that, the double bagging has been recommended. There is also the color coding that we have to follow the same biomedical waste rules. And so those which have to be autoclaved go to red. Then a temporary storage room and separate storage and marking of COVID-19, including in the wards and also in the storage room, is mandatory, and all trolleys as well. Again, it says very clearly that it should be the trolleys and the bins and everything should be disinfected with hypochlorite. There should be proper reporting. There is even in the isolation wards, it should be properly marked. And general waste should go only by the Solid Waste Management Rules 2016, not to overwhelm the system. And also the operation of, even from the sample collection center, it should go to the common biomedical waste facility. So here we see these are the kind of PPEs that are being used and given, to all that. These slides have been provided to me by R. Nisarg from Bombay, Mumbai. And like Ruth mentioned, that it is advised that these are kept after cutting in a paper bag for 3 days, 72 hours, and then disposed with general waste. But now even Mumbai is examining the possibility that it might go for a hydroclaving system before it is discarded into general waste, because there's a little bit of possibility that people are not following these protocols. Rational use, Dr. Malini will be talking more about this. I will not dwell too much, but the healthcare workers are making a big effort to see that PPEs are used rationally and not excessively. This is the common biomedical waste facility, just an example, which is there in Gulbarga. Like you can see, in India, the incineration is only for the anatomical and the pathological microbiological waste. Most of it goes for hydroclaving. This is a hydroclave. There's a blade inside, plus a shredder and washing with hot water. This is ETP, and then there is also the chemical disinfection for glass waste and metal sharp manager, dry heat sterilization. So this particular facility has all, and then it has a vehicle with separate compartments and also HEPA filters. So here in COVID times, they have been sanitizing. Like you can see, like they have kept a wheeled cupboard where they are storing all the COVID waste separately. After every transport, it is being properly sanitized, and you can see that the workers are also wearing PPE. So some of the important challenges that we faced in biomedical waste, one is it's not just 1.5 times, now it's almost become double. Availability of availability of staff is becoming really a problem because people are really scared. Fear factor is a big problem. Then there are some there's a problem about resources because there are many hospitals, small hospitals which are closed and they're not paying. The burden has gone up and the resources have come down, and quarantine centers and homes, we don't know how much to collect, and the availability of cost and also the training part. That is a very big challenge that is being faced in the biomedical waste. But still people are training, people are like Ruth mentioned, how to put on the PPE, how to doff it, and various other training programs. So this is the pictorial guide. As you can see, this has been supported by the Healthcare Without Harm, prepared by the Center for Environmental Health, PHFI, supported by the WHO also, and endorsed by the Ministry of Environment and Forest, Government of India. This shows clear categories. This is the biomedical part of the hospital waste, and this is the non-biomedical part, because general waste also is there in some areas. I will be showing the pictures, and here you can see the transportation to the common biomedical waste facility in a proper vehicle. Here it shows the different categories of biomedical waste with appropriate color codes. The emphasis on is that biomedical waste rules have to be followed, and whatever needs to go into either yellow or red or blue has to go, and even the general waste is to be kept separate and treated as general waste and not mixed with the biomedical waste and not overwhelm the system. Again, this one very clearly gives the various categories. We are very thankful to Yutika and Mr. Vinod Babu and the entire CPCB, which helped us in finalizing. And also it shows intramural transportation, that it has to be very safe and it has to be transported in wheelbarrows in the particular color code. Again, management of spillage. Here also, of course, we are encouraging that there should be no mercury-based thermometers or sphygmomanometers. But if they are there, and this is the way to deal with it, the same way with the body fluids and with chemical spillage. Here again, you see the blue category waste, that it has to be disinfected or autoclaved. And the emphasis a lot is on autoclave, especially for things like whatever is going to be recycled. And here it is in safe method, like using hard cardboard boxes and rather than only plastic bags. Here again, we see management of metal sharps. Again, the emphasis on dry heat treatment. And this is just to show what a common facility looks like. This symbol, this icon is for common facility. Here again, it's common facility, saying that it can be done in a captive facility or in a common facility. So here again, you'll see the red category, which is, as I said, the one-time plastics. But here again, the emphasis is on lot on autoclaving and microwaving, and whatever can be washed and cleaned and shredded can go to an authorized recycler. And So plastics are recommended like this. Even the COVID plastics are recommended for being put like shields or the splash gowns. All those are meant to be put only in red. Again, here you can see only the incinerable waste. As you can see in India, it is mostly anatomical, pathological, and only after autoclaving then goes to the incinerator. But otherwise, the emphasis is on minimizing. So these are the standards. So whatever is there in Schedule 4 of the biomedical waste rules have been shortened here, but have been mentioned very clearly. There was this poster was developed even before COVID. There was always an emphasis on good PPE, and like all the speakers mentioned before me, the important thing that we have to remember is we have to be safe always, and safe from several microorganisms and not just COVID. So as you can see here, the emphasis is on not to throw it into the municipal bin. Again, you can see here that the emphasis is again to safeguard yourself, to post access, and then you can also see that bad practices are avoided. Here again, you can see the general waste area from in a hospital is kept separate, and the biomedical waste is kept, the waste is kept separate. Again, this is the COVID posters, which clearly show that we have to maintain the same system and what are the things that need to be put into yellow and red. And this we have made it in English and Hindi. And of course, in the several states, they are probably planning to make it in their own state languages. This is only the camps, homes, and the home care facilities. They need to put it into yellow bags, but not the food waste. This is all the various other waste which comes, and including the diapers with excreta, and also the various tissues and other equipment that is being used for the COVID patients in the quarantine. So as you can see, the issues are basically segregation has been in the under the SWM rules in the community category has been a little difficult. Cost is again a big challenge. Dedicated staff in the community area, I think Dr. Ramesh Kumar will be talking about it. Safety of workers also, he'll be speaking about it. Guidelines for the quarantine homes also has been very clearly mentioned that again double bagging, but from quarantine homes it has to go into yellow, but it has to go to the common biomedical waste facility and not to the incinerator. But unfortunately in some of the SDMC areas it is still going only to the WTE, waste to energy plants. These kind of discrepancies are still there. Additional points which CPCB has given, I already mentioned the excreta and collection of the PPEs such as goggles, face shields, splash-proof apron, coverall, hazmat suit, nitrile gloves only in red bag, and only the masks and shoe covers and disposable, the non-woven plastic, that has to go into yellow bags. Then the additional clauses for home healthcare has been also mentioned by CPCB, and used masks and gloves generated from home quarantine has to be kept in a paper bag for 72 hours, which as I told you is a little difficult. So we are examining the possibility of using hydroclaves. States not having CVWTFs and rural remote area, they can go for deep burial. So these are there's some IEC material provided to me from the MCG, from Municipal Corporation of Gurgaon. They are doing a double bin and a bag, and also the waste segregation guidelines. We have these. So they made some guidelines for the MCG also, and they have been following. But definitely the sanitary waste is kept separate, and that is only collected by the MCG. This is being provided to me by R. Nisarg. They have even provided sanitary kits and various disinfectants to Dharavi. But, it is a big challenge. It is being addressed. The responsibility of local body is that they have to follow a proper SWM plan, and they have to make housing and marketplaces safe. They have to make bylaws and impose it, and also use a fee. So the same way, there are duties of all the public local bodies is for creating awareness and making sure that there's no littering, minimization of the generation of waste, and practice segregation, and also home composting and vermicomposting. This is being emphasized. So segregation, we all know, but the unfortunate part is I'm really unhappy to say that even in my own colony, I'm trying my best, but the community is not practicing very good segregation. So this is what actually the rules say. NIUA helped us when I was in doing the Swachh Bharat mission. We prepared this. I was the one who prepared it. And it clearly says that it is not to be overwhelmed. The sanitary waste, the domestic healthcare waste is supposed to be kept separately, and it goes to the common biomedical waste facility. And the dry and the wet has to be managed to the maximum extent in the home or in the community, but it can go to any common facility where it's being done. So also the dry waste. So IEC can be improved only through a lot of different types of educational material. And of course, in COVID times, it's very, very difficult because you're not meeting anybody and it's all virtual and digital, but still this has to be done in one way or the other. And in our several of the SDMC areas, we have tried our best to do some amount of training and education through word of mouth and through the various committees and RWAs. Like you can see, this is a good practice. This has been done in Ambikapur, and you can see the counselors are involved in the training. So also you can see in Indore, and of course the local bodies' responsibility is also to set up proper facilities for segregation. As you can see, especially for the informal sector, providing them training and also identity cards. Collection of plastic waste has to be done very, very carefully. These are some cities in south, down south. This is Ambikapur. Again, domestic hazardous waste is separately collected, and so also the disposable plastics. Indore, again, they have a very good practice: wet, dry, and the sanitary, the domestic hazardous. Again, local responsibility, local body responsibility. Wet waste, these are being provided by another group from Gurugram. They are doing training and education, and they have provided the PPE, and they are managing the food waste. You can see here that this is going on even now. Green Bandhu, but there are other organizations also which are doing it in their own, like Nirmana County and several other organizations which are doing community composting and localized composting. So the material recovery facility these days is very, very important. This is a good practice in Ambikapur, but unfortunately, I don't know, many local bodies are, I think Dr. Ramesh Kumar will enlighten us on this. So after segregation, unrecycled plastics can go for road making or for generation of fuel like diesel, petrol, and aromatics. Most important part is that we need to still educate people about different types of plastics and how things like we had an accident with styrene. So things like polystyrene and PVC need to be removed. Most important part is the behavioral change. And many people have asked me, what is this? You know, there's so much of plastics which is going up and PPEs. So it is all the more necessary that we remove the single-use plastic in unnecessary uses in our daily life, so that things like PPE can be used. Now all the waste is this single-use plastic, and therefore that's a big challenge. This is from Bengaluru. Hasiruddala has provided me with these and they collect their plastics right from homes itself. It is segregated, DWCCs. And you can see even from high-rise buildings, they do home composting collection. They also collect from individual households. They provide a lot of training, education, and proper facilities for the waste collectors. And they can either sell it to ITC WAR project, or they can sell it at the various other godowns. So in class 1 cities for sanitary waste, this is again from Bengaluru. They have been following a good practice. They collect it at their DWCC and then give it to the common biomedical waste facility. In remote areas, this is what we have tried. completely compostable sanitary napkins, you can practice deep burial. So I stop here because then the rest of it I will show during the panel discussion because I need to cover about how to manage the food waste and how not to mix it with the general waste. Thank you.
Thank you, Dr. Mani, for this interesting presentation. Our next speaker is Dr. Malini Kapoor. Dr. Kapoor is the Professor of Microbiology and in charge of Biomedical Waste at Vardhaman Mahavir Medical College and Safdarjung Hospital. She's a member of Ministry of Environment, Forest and Climate Change, Ministry of Health and Family Welfare, and Central Pollution Control Board Expert Committees for Biomedical Waste Management Tools, and also the recent guidelines for managing COVID waste. Dr. Kapoor will talk about the challenges faced by the healthcare establishments while managing biomedical waste with a special focus on COVID-19. Ma'am, over to you.
Do I have to stop share or something?
Dr. Mani,
am I audible?
Just now, because you were muted till now.
Okay, yeah. Okay, thanks Ananya for the kind introduction. And first of all, my namaskar to you all, my COVID warriors, whether you're doctors, nurses or technicians or the environmentalists also. We have a very important role to play in this war. My topic is biomedical waste management in healthcare facilities, labs, collection centers and the quarantine centers in the context of COVID-19. What are the challenges? So we are all aware during this pandemic, Government of India has established the isolation wards, the ICUs, the sample collection centers, the standalone labs also, and in the hospital also, and the quarantine camps and centers. So if you look at the quarantine centers or the camps, they do not require any authorization. And the definition of biomedical waste is just same as earlier. We have a very comprehensive rules made by Government of India, which are based broadly on the WHO core principle of reuse, recycle. Like there are 4 categories, and the yellow category goes for incineration, which has principally the animal waste and the human waste and some soiled waste. And rest other color categories, the disposable plastics which are used in the lab. The red categories again recycled, it can be used for road making or it can be reused for other, like, and also for waste to energy options. Then you have the blue category, that is the glass waste. Again it can be recycled after sterilization, and then sharps again after sterilization they can be recycled. So during the pandemic, Central Pollution Control Board came up with the COVID-19 specific guidelines, which were last revised on 18th of April, and they will be revised. And the color categories are the same: yellow, red, white, and blue. And these are the various stakeholders. We are all aware of them. And this slide, this particular slide, it looks very simple. It has the solid waste and the biomedical waste under their respective rules. The whole principle is that solid waste or the general waste should not be getting mixed up with the biomedical waste, and similarly the biomedical waste should not get mixed up with the solid waste. And so these are the CPCP guidelines with their revisions. As we all know, WHO and CDC, as this is a novel virus, as the knowledge increases, is revising the guidelines, and so is the Central Pollution Control Board. And the last guidelines, they emphasized on lab waste, the ETPs and the STPs, the PPE disposal, and the management of general waste from the quarantine homes and centers, and taking cue from the CDC guidelines, like the mask and gloves used from by the general population or the normal households. They can keep it for an extended period of 72 hours, cut them, mutilate them, and then dispose them off as municipal solid waste. So this was the last revision, which focused on PPE, ETP and STP plant and the lab waste. See, the disposal was already there in the biomedical waste rules, but with the varied types, the multiple types of PPE, it was again re-emphasized. Again, I'll re-emphasize that the autoclaving or the microwaving or the hydroclaving of lab waste was already there in the biomedical waste management rules. But again, these guidelines emphasized on that. So if you look at disposal at the common facility level, then there is double bagging, and I'm also aware that in an NHS document also it is mentioned at once that double bags may be used just to prevent any leakages or to prevent the safety of the healthcare worker. And color coded bins and bags and containers, they remain the same, whatever is mentioned in 4 color categories based on the nature of the material. Yellow is the soiled waste, and red is the plastic waste, the white is the sharp, and blue is for the glass. And then you have, now this is the typical isolation ward where now the real challenge is like these social distancing norms are also meant for the biomedical waste management collection. Earlier they were carrying close to their body, so they have to be carried away a bit. And then with maintaining the social distancing norm, the sanitation worker from the common waste site, he wears a full PPE because that's a high risk area, the isolation ward, and the sanitation worker who's posted inside the isolation wards hands over to him with social distancing. And then it is carried in various color categories of trolleys like yellow or red or white or blue to the dedicated common waste site. And this is the nursing station, then the isolation ward, the common waste site, and a truck of biomedical waste facility comes, and there it disposes the waste after proper sterilization techniques, and there it is handed over to the authorized recycler. It is only the yellow category which goes for incineration, the red plastic, the white sharps, and the glass, it goes for recycling. And then you need to report the opening or operation of the COVID-19 ward and the COVID ICU ward lab collection center to your respective state pollution control board and the common facility operator, and you need to maintain its separate records. What are the separate record? And in the guidelines are mentioned then general waste not having contamination should be disposed as per the solid waste management rules 2016. See, if you look at the WHO document, it clearly emphasizes that waste which is not having any secretion or any body fluid or any sample from the COVID positive patient is to be treated as general waste only. And then you need to depute dedicated sanitation workers for biomedical waste and solid waste, and so collected and transferred uh, on timely basis to the temporary storage area. Now this document also emphasizes that samples, they need to be pre-treated. This was already there in the rule, but now they are specifically mentioned about feces also, other samples also, and the diapers which are there from these ambulatory patients, they must be treated as biomedical waste and they can be placed in the yellow bag. And they also mention about if the bedpan is used, which is again that can be reused, that's a very good option. Then feces to be washed into toilet and cleaned with a neutral detergent, and water and disinfected with 0.5% chlorine solution. This is again from WHO and WASH document. And now they are mentioned of specific biomedical waste management article disposal like the PPEs, the goggles, face shields, splash-proof apron, plastic coverall, the hazmat suit, nitrile gloves. They are all put into red bag directly, and then it is autoclaved at the autoclaved or microwaved or the hydroclaved at the common facility level. These all plastics, they can be reused, but if you are having heterogeneous plastic, the best is they go into road making. And so the whole idea is now the general population is also using PPE which they were not earlier using, especially the gloves and the mask. So it is mentioned in the CPCB guidelines only, like if you're a healthcare worker, you need to dispose of your these kind of PPE in the red bin. But and not in the municipal solid bin. But if you are a general population, then you need to keep it in a paper bag for 72 hours, mutilate them and dispose of as general waste if you're from general population. And about the yellow category, you have these PPEs like the triple layer mask, the N95 mask, the head cover, and shoe cover, and whatever is non-plastic goes in yellow. And now similarly, the standalone sample collection centers and labs, they need to follow the double bagging or the labeling and the categories. And but there is a special mention, since it's lab, you need to pre-treat all your laboratory waste. For example, the viral transport media, the plastic vials, the vacutainers, the Eppendorf tubes, or the cartridges of Gene Experts, and chips and microtubes of TrueNat, and you need to dispose them as red. These things do not go for incineration, autoclave, microwave, or hydroclave and their respective category. And again goes for recycling. So pre-treatment with the safety standards, and you need to have the color indicator tube with each batch. You need to maintain the control, like daily with the chemical control and weekly with the microbiological control is very important. So what you are doing as the sterilization practice, please pay attention to the waste also. You need to put up your waste in the waste autoclavable bags, autoclave them in the waste cycle, and you can then dispose them off as red category waste, as these are plastics. And if you have glass kind of your lab waste, then autoclave them and dispose them in blue category, so that everything goes for recycling. You can use these special autoclavable containers also, and these are the color indicators. And this is the lab waste, which is pre-treated, and then its respective color category of glass or plastic. And so if you look at the waste disposal as mentioned in the rules, it remains the same. Principally the anatomical waste and the animal waste, that goes in yellow category, and PPEs also, which do not have plastic, whereas our red category is enormous now, which has lots of plastic which can be reused, where the methodologies, they are done at the common facility level, whereas lab waste is pre-treated as the hospital level. It's principally the glass waste, which is again recycled. Then this is the white sharps. This again goes for recycling. And so if you look at the biomedical waste management in COVID context, what are the challenges? Now, training you have to do with social distancing norms, or on the Microsoft Teams software is there, or in small batches of 4-5. And and training also includes, I'll be covering that, all kind of now people, like whoever are there in the hospital. Earlier we were doing of healthcare workers, but now the training also includes the staff in the hospital, which is using PPEs. Like, earlier the security guards, they were not using, but now we are including them in our training, the clerical staff also, and they have to be trained under the social distancing norms. Even in collection of waste also, there's a huge challenge we have to do with social distancing. In barcoding also, the waste tracking app, we have to do with social distancing. And all these healthcare workers, hand hygiene, respiratory etiquettes, they need to be practiced. PPE donning, doffing, they need to be trained on that. And general population is using PPE, which after 72 hours can be disposed of as solid waste, which is mentioned in the CPCB guidelines also. Now for the health checkup, now we have the fever screening clinic coming up, and our immunization are for hepatitis B and tetanus. And our ETP, STP plant operators, they need to be given the PPEs, and Central Pollution Control Board has launched a mobile app for the COVID waste. So this is the training. You can see amount of training we are doing. We are doing on-site training also, that is in the COVID facility of the hospital, in the non-COVID zone of the hospital also, in the lab area, and in Microsoft Teams software also. And we are training all individuals who are working in the hospital, including our CPWD staff. And so this is the biomedical waste management in COVID context with social distancing, collection of waste for barcoding, and you have to train your sanitation workers also for donning and doffing of PPE, hand hygiene and respiratory etiquettes. Now we have a dedicated area for COVID waste management. This is nearer to the COVID zone, so the vehicle comes and picks it up of the various color categories. And the solid waste management, now there are, in the bulk waste generators like the large hospitals or the airports, the general population, especially in airports, the passengers are using PPE. So I'm aware that they have kept the yellow, the hazardous waste bin also in the airport for the disposal of PPE being used by the passengers. And CPCB guidelines mention that mask and gloves after 72 hours can be disposed of in paper bags. And now this is the Central Pollution Control Board mobile app, wherein we are giving our data on real-time basis. And very soon, it is an Android app. It will be made more user-friendly. And in this way, the can be tracked, whether how much is getting recycled, how much is getting, what all categories of waste is there. Like it is basically for the life cycle of the waste. And so, and there are certain responsibilities of the persons operating the quarantine camps. The solid waste generated from the quarantine centers or camps, they need to be handed over to the waste collector identified by the urban local body. This is very important. And persons operating the quarantine camps and centers, they need to contact the operator to collect the biomedical waste. And it is mentioned that it is to be disposed of in yellow bags. But if you have diabetics, please follow all color categories: yellow, blue, red and white. If you have simple patients on oral medication, yellow bags are fine. But if you're having diabetes or patients with other comorbidities, please use all color categories in the quarantine centers also. And now this is a very pertinent topic. Though CDC says that risk of transmission of COVID-19 through sewage is low, and operators, who are operating such facilities, they need to ensure that the sanitation worker, who are there, need to be given full PPEs. And you can keep a yellow and a red bin there in near your ETP and STP plant. And any good effluent treatment plant who's covering the norms mentioned under the biomedical waste rules, has the membrane filters, the chlorination and UV filtration as a step. So it is really not possible that any coronavirus would survive. But there are reports that sewage is a very good sample for serosurveillance of coronaviruses, which can be used in or in the other zones. And as per the NGT order, they take a special mention about the sanitation workers to be given full PPE. And in case the sanitation workers is showing signs and symptoms of COVID infection, then he needs to take care of that sanitation workers and get him tested and get him admitted in the Corona Center. And as per that, the Biomedical Waste Management and the State Pollution Control Board and the Central Pollution Control Board considers it as an essential health service. India is, I think, one of very few countries which have a Supreme Court tribunal sitting on the environment issue. This is a very positive step, and I think it started in 2010. And to summarize, so I would say, yes, there are 19 biomedical waste management, but COVID-19 is not a grade 3 pathogen. It is just as per CDC, in fact, it has lowered even the persistence of COVID-19 viruses. It is just a virus which is like H1N1, but definitely not like the hemorrhagic fever viruses. So I would say that you maintain whatever you were doing earlier under the rules, but you need to practice biomedical waste management with social distancing, with hand hygiene, PP, training on PP, donning and doffing, respiratory etiquettes. There are rules which are already there, which are based on the WHO core principle, and their amendments have been notified. And then there are CPCB guidelines for COVID-19 waste, CPCB mobile app. It will be made user friendly. And then there is an issue that common facility operator think that let us raise the price in the COVID-19 time, but I don't think there is any need to raise the price for the COVID-19 waste, because if you consider the COVID waste, if you analyze your respective hospital data, like I have analyzed the COVID waste during the COVID pandemic, and if you add on the non-COVID waste, it is definitely less than what we were getting in December, the whole biomedical waste. So, the prices should just remain the same, but I've been hearing reports and general population using PPE, store them in a paper bag for 72 hours, mutilate and put them in municipal solid waste bins. And then for the solid waste management, it is to be ensured that the municipal vehicle comes daily so that this waste is also picked up. And NGT, it labels that it is an essential health service, and we need to ensure that all our COVID warriors, especially in waste management, especially sanitation workers, of course we have doctors, nurses, technicians, but the sanitation workers who are posted in COVID ward, labs, ICU and quarantine center, they come under the high risk category, and as per the rational use of PPE by Ministry of Health and WHO, they need to be given full PPE in these COVID zones of the hospital. And biomedical waste management is an important public health concern, and it is not only our legal responsibility but also a social responsibility. So whatever solution we are suggesting now, they should be sustainable not only for this generation but for next 10 generations. Namaskar everybody, and thank you. Stay safe. Thank you.
Thank you, Dr. Malini, for such an interesting presentation and sharing the perspectives of healthcare sector. I would like to introduce our next speaker, Ms. Yutika Puri. Ms. Yutika is a scientist at Center Pollution Control Board. She has a background in environmental engineering and has been working with CPCB since past 10 years. Currently, she is dealing with biomedical waste and battery waste management across the country. Ms. Yutika will present on the response of policymakers to tackle the challenges of healthcare waste management in India during COVID-19. Over to you, ma'am.
Thank you, Ananya, for having me, and thank you, Dr. Purnima, for having me once again with your team. And I really, when I see the pictorial guidelines, I really feel so happy that we are more able to express what should be there at ground with the help of those pictorial guidelines, and your guidelines are being referred at many platforms, and this is a good work, I must say. So the topic was given to me is role of policymakers to tackle the challenges in the entire biomedical waste management. So we have heard Dr. What is happening? Wait a second. Yeah. So Dr. Mani and Dr. Malini Kapoor just explained so well what all practices should be followed, and whatever the provisions we have, whatever legal framework we have for the management of the biomedical waste, including COVID waste, because we feel that COVID waste is not very much different from the non-COVID biomedical waste, and if we are able to implement and if you are able to perform the duties as per the legal framework in a very well manner, then I think we would be in a very great situation, so that there will be no panic with regard to the waste management. So we have heard enough about the practices with regard to the segregation, with regard to the like treatment and disposal options we have. So these are the policy makers, like many ministries are nowadays, they are issuing so many guidances in the form of guidelines, technical reports, some public notices. There are every other day we have some new news in the form of public guidance from these important ministries, I must say. And CPCB works under Ministry of Environment, Forest and Climate Change. So CPCB has also issued separate guidelines for the management of COVID biomedical waste, which is generating from the, not only from the hospitals, but from the quarantine centers, camps, home cares, etc. And there is no separate provision is given under these guidelines, only precautionary additions we have given. For example, double layer baggaging and segregation, and what items can be considered as contaminated waste, what items are simply just as usual solid waste and which can be disposed of along with the other solid waste. So these are the and yes, we have explained certain duties for the hospitals, for the treatment facility operators, in fact for the authorities, for example state pollution control boards and local bodies. They have their own roles to play in the entire situation. So these are the implementing authorities. Next is small scenario. If I want, although these figures are not very accurate, I must say, but whatever the data I am compiling nowadays, which I'm daily, I am following up this matter with every state, almost every state. I make a call to state government, state pollution control board, and this is the data I can say this is the conclusion of my whole analysis, that approximate 60 metric ton per day of COVID biomedical waste. This figure doesn't include any non-COVID biomedical waste. This is the exclusive figure for COVID biomedical waste generation, which is coming out of the hospitals, camps, and other areas. And we have out of 200, more than 170 common facilities are already involved for the treatment and disposal of this generation of this quantum of COVID waste, biomedical waste. I emphasize on this word. And treatment capacities, if I talk about the incineration, so this is the treatment capacity which is available with us in our country, and so far it is adequate. Still there is an issue, I'll explain later. So these are the common challenges which Dr. Malini had just shared, and Dr. Shamla Mani explained so well, that these are the things and these are the challenges. So we all know what should be followed, but still we face some challenges. For example, healthcare facility, we know like segregation is to be done in this manner, and hospitals are saying that we do train our staffs, our nursing staffs, our healthcare workers, and during this COVID pandemic, as Dr. Mani said, like their guards are also being trained for this. But things still, there is an issue for the small practice of segregation, because nowadays people are more scared of this entire COVID pandemic, and they are not even want to touch anything. They are simply throwing everything in. They are considering everything as a contaminated waste, which is not correct. So their segregation fails. So segregation fails, and many problem arises. For example, increase in quantum of waste, which is ultimately going to the common facility operators, and they are overburdened nowadays. They have enough capacity to tackle the biomedical waste, but since the general waste is also coming, is also reaching to their incinerators, which is, and these incinerators are very technical, highly designed, meant for only biomedical waste, but the general waste, which is 80, 70, 80, 90% is wet waste, and they are, the highly designed incinerator can also be failed if they repeatedly incinerate this wet waste into those incinerators. So because of this small segregation problem, this could happen. And being a policymaker, I really sometimes we feel that absence of record is a major issue, because with the without everywhere, if we want to plan anything, then we need to have some database, and for that, record maintenance by every stakeholder. I'm not saying not only it is the duty for healthcare facilities only, but it is a duty for every stakeholder. For example, healthcare facilities, treatment disposal facilities, and state boards, and as pollution control boards are prescribed authority for, so it's equally important for them also. So still this is a this is not happening in a right manner. So these are the one of the challenges, I must say. Now for treatment and for healthcare facility, awareness is also another major issue because of the same reasons I've explained earlier. Next is treatment and disposal facilities. They are working day and night, no doubt in this, and they have, even for the collection of waste from the hospitals, they had to convince their workers that we take your responsibility, you just go and perform your duties. So it is itself is a big challenge for them. And in this challenging situation, again, the very next challenge is to comply with the standards, because if they don't get the segregated waste, the incinerator fails to perform as per the standards which biomedical waste management rules stipulates. And next is daily collection of waste. Because we have I have in my country healthcare facilities and other newly setting up quarantine camps in the isolated areas also. So it is a challenge for them to reach out those interior corners, and they, in that situation, they usually skip collection of waste on daily basis, or in a week they are going something they are managing with. And again, reporting of data is another concern. Local bodies, in this COVID scenario, there is a specific duty of local body for waste collection from home cares and home quarantines, because the common facility operators cannot go to hundreds of or thousands, in fact, home cares or home quarantines to collect for collection of waste. And as our government is now saying that people with mild symptoms or no symptoms, in fact, they if they are not very much serious, so they are asking them to stay at home for quarantine. So this thousands figure will be in lakh, no wonder in this. And my operators are only 200, so they cannot send their workers to each and every home care. So there we want local bodies or urban local bodies to play a very important role. For they, in fact, they need to coordinate the entire cycle of collection of waste. Then they will collect the waste from every home care, and then they need to set up the collection center, and then finally the waste will go to the common facility operator for final treatment and disposal. So local bodies, they have very important role to play here, to provide adequate PPs to their workers also, and yes, setting up of collection centers for the temporary storage of waste. Now CPCB proactively prepared the guidelines. There was no specific orders from any court body or from any, there was no reference. But yes, we felt that we already have biomedical waste management rules which talks about the management of how it should be managed and how it should be treated. We have treatment options, disposal options, etc. But still we felt that it is a high time to give the separate guidance to the people. Like and when we first released the guideline, the figures of positive numbers were very less. Now we have entered 2 lakhs figure, and yes, nowadays today I can say this, that step, that day we decided to release the separate guidance was the right decision, because our guideline not only covers the duties or aspects with related to healthcare facility, but also to the general public. And I really appreciate my expert committee, in which Dr. Malini is also one of the member, that they helped a lot, and we worked really day and night and to finalize these guidelines. So this is the separate guidance we gave. We held consultative meetings with state boards also. We explained what because there was a lockdown in there was a time where everybody was sitting at home. Today also we are sitting at home, but still partially opened offices are going on, but still that time in March, early March or late March, I can say, people were totally confused what to do and what not to do. So we held so many meetings with my state boards also to explain the things. We issued do's and don'ts, so that it becomes very handy to refer. And I have placed a separate corner on CPCB website also, so that any general public also, anytime they may visit the page, and whatever the update we get, we just simply placed over there. So do's and don'ts we have given over there. Posters, we are making posters. We are trying to depicting our detailed guideline into the form of posters. And yes, as this matter is being now, it is reviewed by the National Green Tribunal also. So as per their orders, we have constituted high level task team, which comprise of members from Ministry of Environment, Ministry of Health, Ministry of Housing and Urban Affairs, Ministry of Defense. With this team, we already held one meeting also, in which we have invited every state government, including health, environment, and pollution control boards. Where this particular team is headed by the chairman, Central Pollution Control Boards, and we have reviewed the entire scenario state-wise. In fact, what is going on, and what all are the gaps, and how to overcome these gaps. So next is we have developed waste tracking app. So it is something with which we can track the waste. It is not only to get the data, but I have many examples to share, but I'll not share here, which talks about the pilferage of waste. Hospital is doing their duty, common facility operators is performing their tasks, but still we have examples for the dumping of waste, for the burning of waste, and etc. So, and especially this COVID waste, we cannot afford to have such kind of situations. So that is how this particular app was developed. And there are certain users in this app: waste generators, waste handlers, common facility operators, and the pollution control boards. So these are the four kind of users. They will simply, it is a very simplified, it is a very simple app. You just need to register, and you just need to feed the daily data. What is the generation and how much you are giving to the operator. Then again, operator will feed the data, like this much quantum of waste I have received, and so on. So at CPCB level, we have started monitoring the kind of data we are receiving. And so at some point of time, we feel that there is a sudden increase in waste, and sometimes we feel that the number of bags are very less indicated over the app. So this is how we can control the things, and immediately we discuss the thing with the concerned government, state government, and through their help, in fact, we sometimes reach out to the that particular hospital also. So, and we try to resolve the matter. So this is how the tracking app was developed. Next is the broad requirement of entire COVID waste management. I try to gather these 6 points. So very first requirement of this situation is to strict implementation of existing biomedical waste management rules, which covers all the aspects. These rules are very beautifully framed by Ministry of Environment and Forest, and I think in India only the provision of segregation is there, because in other countries they are not segregating, and they are simply collecting the waste in just single bag, and they are doing the sterilization, and they are shredding, and they simply dump it on the landfill. But here in India, because of so many reasons, we have the concept of segregation, and which can be, if it is implemented properly, then we can say yes, it is a good thing to have. So next is, state should develop a model plan, because in cities and in big states we can say, okay, this is, you know, this is a workable thing. But the challenge is at the district level, at the in the small villages. So we want to develop a model plan to be implemented at the panchayat and district level also, so that, you know, if the common facility operator, for example, is not available in around one village, so how the COVID waste especially will be managed over there. So we want state to prepare a model plan for that and to further implement it. Next is safety of our workers is very important, because if our workers are not safe, they couldn't perform their duties, and the entire waste management practice will be vanished. And moreover, their safety is very much concerned for the government also, because they are directly handling the waste. They are the people, because we are sitting at our home, but they are the people who are in the lockdown season also, they were on the roads, they were performing their duties. So safety is very important for those people. Now, adequate common facilities. I said there are 200 in total common biomedical waste treatment facilities, but in some states, first of all, there are 7 states where there is no common facilities there, and they are simply either deburring the waste, or they have some captive incinerators. Captive means some hospitals, they have their own incinerators, and they are disposing the waste through them. So, but still, states who already have the common facility, but the adequate numbers are not there. So this is the high time, and in fact, at the ministry level, we are reviewing this particular topic, like to expedite if any proposal is there for setting up of new facilities, so that you know, so as to handle the situation. Next is encourage utilization of industrial incinerators. For example, in a state where common treatment or biomedical incinerator is not available, so we can always use industrial incinerators and hazardous waste incinerators in that case. And deep burial is the last option. Deep burial should be the last option, because we never know if we are deep burying the COVID waste. Then I don't have even, in fact, I don't have any certain study which say that you know, if I deep burying the entire untreated or you know, sterilized, non-sterilized waste into the ground, so what will happen to my water and soil, etc. So this is the thing. And yes, regular monitoring by the prescribed authority should be the next requirement of the situation. Some initiatives, some state boards, they are doing their very good job. They are issuing public notices, radio jingles. Bihar, Maharashtra, in fact Tripura, they have their own radio jingles which talks about this COVID waste management. Some states have developed their online manifest system to fetch the data of COVID waste, and state boards have prepared their own SOPs also, which is also very nice, and some short videos which are available on YouTube also. This is UNIDO. There is a one UNIDO video on which explains the entire COVID waste management is there. So these are the things. That's it. I don't have many slides to share, but I guess I've tried to cover as much as possible. So thank you from my side. Thank you.
Thank you, ma'am. Thank you, ma'am, for such an interesting presentation and sharing your thoughts on this crucial aspect of waste management. I would now like to introduce our next speaker, Dr. Ramesh Kumar. Dr. Kumar is the Medical Officer of Health and Director, Public Health New Delhi Municipal Council. He has been working with NDMC for the past 20 years, and his area of expertise has been solid waste management. Dr. Ramesh will talk about the key issues in handling, treatment, and disposal of waste in COVID-19 scenario. Over to you, sir.
Thank you for inviting. In fact, I must thank Dr. Malini also. He informed me about this program. Thank you all the panelists. Me, Dr. Ramesh Kumar, basically I am looking after the municipal solid waste management. And if you talk about any municipal body, it is basically the implementing agencies. And I feel sorry because we are very busy from the early in the morning to late night. I could not make any presentation. I will talk about all main headline on the handling, collection, treatment, and disposal of the COVID waste as well as solid waste management in NDMC area. If we give, I will talk about only the practical aspect, not the theoretical aspect, what we are doing and what we are implementing on ground at our own level. We don't require any help from anybody. We have very small compact area, 42.7 square kilometer area, having the fixed population about 2.76 lakh fixed population. No doubt we have a floating population about 15 to 20 lakh, but at a time because most of all the offices and the market areas are closed. And as well as our Safai Kramchari is concerned, approximately about 2,000 Safai Kramchari we are having for our cleaning purpose. And as far as NDM's area, 50,000 household, we are catering the solid waste management facilities out there. In NDM's area, almost 100% door-to-door we are carrying out by deployment of our auto tipper trucks, which are having the compartment for collection of dry and wet waste and a bag for collection of the domestic hazardous waste. No doubt segregation is a big challenge in all the municipalities, but as far as the NDMC is concerned, we have carried out on an average 85% segregation in NDMC area. But this is still a big challenge because it is a continuous process. We keep on motivating our household owners to give the segregated waste, but it is a continuous process. No doubt for that we have involved all the resident welfare association and market data association to cooperate with us. For that we have a regular interaction. Almost every fortnight we keep on interacting. We are sending message or because of the corona we are not interacting with them, but we are having some video conferences on the and phone by telephonically. And as far as the solid waste management is concerned, approximately I will concentrate basically on the COVID waste management, not the solid waste management. Everybody knows the solid waste management, but basically because at present main issue is the collection, treatment, disposal of the COVID waste. For the COVID waste in NDM's area, we have deployed dedicated one vehicle because we have not engaged the existing vehicle for who are collecting the solid waste collection. We have identified one dedicated vehicle for collection of the COVID-19 waste from identified households. This is a big challenge because we keep on training, we keep on counseling the workers who are engaged for the COVID waste contact. Basically, they are very scared. Now we have trained them, we have provided all the protective equipment. We are continuously, in fact, daily we are motivating them. This is a noble cause. You are the real warrior. You are doing this practice. And in fact, we are carrying out the routine checkup every week about their checkup. But in the morning, we are taking their temperatures and the physical and the personalizing, because personalizing is very important before the start of the work and after the start of the work. In fact, in NDM's area, about 35 to 40 households we are covering. We have one dedicated vehicle. A dedicated vehicle start early in the morning from 7:30. He goes all the households, 35 to 40 houses we have identified. We got the list from the DM office. Before we got the list from the DM office, our resident welfare officials are so active and so proactive. They inform telephonically, this household comes positive. You start collecting the waste. In the vehicle we have this yellow double layer bag and black bag for collection of the COVID waste and the household waste. For the collection, of the COVID waste, this identified vehicle, they collect, and after the collection, they go to one place where the authorized agency collect all the COVID waste, and we are in NDM's area one isolation facilities at the Connaught Place area. From there, there's all the COVID waste, and from the COVID waste of the households and the COVID waste of the isolation center go collected by the authorized agencies and go to the common biomedical waste management facilities. No doubt, this I must appreciate the CPCB and DPCC to issue the do and don'ts, which are very helpful. We have distributed do and don'ts to all our resident welfare association and market aid association through their mobile or through their email, so that they can aware. But still, this is a big challenge to collect the COVID waste from the household. Initially, the COVID waste, they are just keeping on the roadside or throwing in the trolleys. We told this had to be collected from your household only. This is a continuous process that we are interacting with them. In fact, you talk about the challenges. Challenges is a daily continuous process. We keep on counseling to our Safai Karamcharis and the household waste collector Safai Karamchari, and we keep on training. And plus, one part is a vaccination. Vaccination is very important for these staffs, because they can have some or other medicine because of the common household. Because in India, people is very reluctant to do the segregation at household level. And another is that the personal hygiene of the our Safai Karamchari is very important. So we keep on telling, before you come to the duty, you should have a bath regular base, and after your duty, you should, before going to the school, before going to your house, you should clean your hand, foot, and face on daily basis. And then they start telling from where we wash our hand, where you dispose your facility, you dispose your waste. We have provided sanitization facilities plus a separate washroom for the cleaning of the hand, face, and feet. And challenges, it is a continuous process. Some or other challenges facing the household level. They are not sanitizing or not giving the waste in a proper way. That we keep on interacting with them. You have to do. You have to give COVID waste. COVID waste is a face mask, gloves, or your spoiled article. No doubt, in NDM's area, our public is very cooperative with us. They are helping in a lot, and this is a continuous process. Because time is very short, I have basically clicked very important aspect. I didn't go a lot. I want to give you more details about the NDM's area, what NDM's is doing as far as the solid waste management is concerned, because for the last 3 years, NDM's is getting first prize in the source surveyation in 1 to 3 lakh population. But COVID waste is a big challenge. For that, we are regularly sending report to DPCC, and we have already sending the report on the app, what is it called, the waste tracking app. Daily we are sending the reports. Thank you.
Thank you, sir, for sharing your thoughts and experiences. Moving on to the second segment of webinar, that is the panel discussion. I would like to invite Dr. Purnima to kindly come on board and moderate the session. During this session, we will be having a set of points that are key issues of concern around waste management. And during this, basically, we will call out on each topic, and this topic will be then shared with, it could be directed to individual speakers. So, Dr. Purnima, over to you. I will just take a moment to put up the slides.
Yeah, thank you, Ananya, and thank you to all the speakers for all those rich presentations. I think there was a lot of interest and queries also raised in the question and answer windows. But there are at least 5 to 6 key issues that we thought that would be important for you, the panelists, to address during this session. So may I now request, Ananya, are you sharing the questions? Yeah. Yeah, so I'd like to address this first question to Dr. Malini Kapoor, and I'll request all of you to keep it as brief as you can. We are already on the top of the hour, at the end of the hour that we had envisaged, but we can see that there is so much interest and so much of request for clarifying various aspects of waste management. So without further ado, Dr. Malini Kapoor, can I ask you to address this first question with regard to the safety of healthcare workers within the facilities, the COVID-19 hospitals? What are the challenges and what do we need to keep in mind regarding their safety? Dr. Kapoor, you have to unmute yourself, please.
Am I audible?
Yes, now you are.
Thank you, Dr. Purnima. Like the challenges in the COVID-19 hospitals and the safety of healthcare workers that I've already, especially the challenges in the COVID-19 hospitals, I have already addressed in my PowerPoint. Like, everything has now social distancing, whether it's biomedical waste management, and everything has hand hygiene training needs to be extensive, respiratory etiquettes, the donning and doffing. They need to be trained, all the healthcare workers. And the sanitation workers are at the lowest rung in this. And so whatever little we are doing, everything is little. Whatever extensive we are doing means is little. We have to take their classes, social distance, by maintaining the social distancing norm, the barcoding, the biomedical waste management, and these have a scare for COVID-19, and every class we motivate them that you are the real COVID warrior and you have to really take this in your stride. And then we are also quarantining the staff, after every 14 days we are giving them rest. We are posting them in the non-COVID zone also, after getting them posted in the COVID isolation wards or at the common waste site. Then we are giving them lighter job. And then there is a CPCB app also, that is also that is an Android app that some of the hospitals, they are mailing the CPCB for the data. And in the biggest challenges from the common facility operator, like they're asking extra. Otherwise, if you compare the COVID biomedical waste and the non-COVID biomedical waste, and if you add them, you'll find that whatever data we were getting in December and Jan, it is less. The biomedical waste quantum is not same as that what we were getting, because not many patients are visiting the hospital. It is mainly the COVID patients and the emergency patients or the delivery or the labor room patients who are visiting now. And our biggest challenge is not to mix biomedical waste with the municipal solid waste. That is the biggest challenge. And we have to take on-site classes also. And uh, uh, and we know that it's a major public health concern, but we have to, at the time, we also have to make the public also aware of their social responsibility. So what we are doing is, in our classes only, we are training our healthcare workers so that they can train their other family members also how to dispose of mask and gloves. And as far as the safety of healthcare workers is concerned, it is of utmost importance, because like especially the healthcare workers who are posted in the COVID zone, like the COVID isolation wards, ICUs, labs, or the SARI, severe acute respiratory ward collection centers, they need to don full PPE. They have moderate to high risk. And as per the MOHFW guidelines and the WHO guidelines, they need to be trained on full PPE, donning and doffing and disposing of the PPE, and getting trained on the hand hygiene, respiratory etiquettes. And COVID-19 has given many messages that it's a major public health concern, and public health is an important subject, and healthcare investment is also crucial for all the government, all the countries. And whatever solution we are having now should be sustainable, and we also need to maintain the adequate and appropriate supply of PPE, whether we are posting our sanitation workers or doctors, nurses, or technician in COVID or the non-COVID zone, by maintaining the rational use of PPE. And basically, we should be giving protection to all who are our healthcare workers, who are the main COVID warriors. And depending upon whether they are posted in the COVID zone or the non-COVID zone of the hospital. And that's it. Thank you.
Yeah, thank you so much. I think you touched upon very many pertinent points over there, from rotation of the healthcare professionals from COVID to non-COVID duties, the rational use of PPEs, and also the cascading of the training from through healthcare workers to their families, etc.
Yes.
I think those are very important points. Thank you for raising those and highlighting them. Address the next question to Dr. Ramesh Kumar. Were the issues around the safety of municipal waste and sanitation workers. You might have touched upon it, I think, a little bit, but if you want to elaborate a little bit more on how we address this.
Basically, we talk about the safety of the municipal waste worker. It is a daily challenge. For that, we are carrying out counseling in the early morning. Me and below me, my chief medical officer and inspected staff, they go early in the morning and keep counseling and keep interacting with our Safai Karamchari. We ask their problems if they face any problem during work hour. Basically, we have to gain their confidence. Actually, we have to lead from the front. For that, we regularly interacting with our Safai Karamchari, and plus training part also. We train how to use protective equipment, a correct way protect equipment. For that, it is a daily routine. It is a daily routine we are doing, plus the hand hygiene, because they are cleaning the area, public places. So public places, for public places, we have carried out anti-spacing law also. 1,000 rupees challan we have enforced. For that, we are carrying out a special team for enforcing this rule to the violator who are spitting on the public places. We are collecting 1,000 fines to them. No doubt, the public is also now very disciplined because of the COVID. They are very scared. So no doubt, we have to implement them. Plus the social distancing. Dr. Malini is also social distancing, because in our Safai Karamchari, in the lunch hour, they keep sitting in a group. For that, we advise you keep maintain the social distance during their lunch hour and during their break, which we are keep on trying in the early stages also, during in the month of March, in the February, March also, because you have to maintain social distance during the working hours. This is a very key and very light issue, but is the most important issues. And during the early morning, we keep on asking, are you okay? In your house, is anybody suffering from any problem? For that, if a person said a person in my family, one or other person is suffering fever, then we send our medical team to their household and check, so that this give a boost and this give a moral support to our Safai Karamchari. We are with them. No doubt, we have a cashless facility for our Safai Karamcharis also. And next is the vaccination part, which is very important. That we are also taking care of that on an average basis. After every 6 months, this is a annual feature. We are carrying out the medical examination of the Safai Karamchari. We know the data who are at the medical risk, who are chronic disease from diabetes and those have hypertension. For that, for them, we are giving very light duties. That we are taking care of our Safai Karamchari. Regarding the safety of the municipal waste, basically it is also a big challenge, because we have to deal with a public community, and it is a man management. Man management is very tough subject. For that, we have a good number of the household. They are interacting with whether if you want any help from resident welfare officer, they are helping us. Thank you.
Thank you, sir. I think that's a very important role that you play, you know, motivating the Safai Karmcharis. They are such a crucial part of our ecosystem, and keeping them motivated is really, really important. Thank you for that role that you embody. So can I request Ms. Ruth Stringer to address this next point on the role of educating the waste community about the use of PPEs in the right way?
Thank you, Dr. Purnima. Yes, of course I can. So I mentioned this a little bit before, but I think it's really important that people understand about PPE for waste workers. It's not the same as that for medical workers. Waste workers need it every day, and usually it's not disposable. So what they need is they need boots, strong gloves. Depending on what they're doing, they may also need them to be heat protective or resistant to needle stick injuries. They need an overall or other uniform and a waterproof long sleeve apron or gown, and they need face protection. They don't need the FFP2, FFP3 or N95 masks that are being used by medical workers because they are not being exposed to aerosols in the same way. But what they do need is protection against splashes and something that stops them touching their face. So they need face shields, goggles, and a surgical or cotton mask. Personally, I think that the face shields can be very good. And they're also particularly easy to clean. And one thing that's often overlooked is tongs. Nice long tongs like you would have for a barbecue, so that if some waste is spilled, they don't have to pick it up with their hands. They should be minimizing handling of waste in any case. That's, yeah, it should all be bagged, and you know, if it's not, they need to be protected from having to touch it in case there's something like glass that will pierce their gloves. They should be able to clean the PPE properly if they're going to reuse it. And of course, remember that, I mean, you know, only PPE that is designed for reuse should be reused. So PPE can be sponged down with soap first. This will remove dirt, which inactivates disinfectants, and it'll also destroy the coronavirus. Then it can be wiped down with disinfectant to remove other pathogens. And it can be either 70% alcohol or 0.1% hypochlorite, and that will depend on what's available. Also, what is appropriate for the equipment in question. Obviously, it's got to be compatible. Working clothes like uniforms or overalls should be provided by the employers and washed in the hospital laundry, not to be, you know, their own clothes to be taken home for their wives to wash by hand. And they should be washed at least 60 centigrade. And this maybe is another lesson that we learn about the proper development for hospitals from the virus, is that, you know, a lot of hospitals, at least in the places that I see, you know, and many of them outside India as well, is they don't have proper laundries. You know, stuff is being washed in cold water by hand, and this is where, you know, good investment can be made. As for municipal workers or anyone working in the informal thing, they should have a very similar sort of PPE. And it's far too often that they don't have it. But, you know, the question is about educating the waste handling community about the use of PPE. It's not just them that need to get the message. So often when I see people not wearing PPE, it's because they don't have it or it doesn't fit properly. And they know, you know, and people, you know, if it doesn't work for them, they won't wear it. This is not all to be put the burden on them. They may not understand the risks. There's research in Bangladesh saying that people actually believe, the waste workers actually believe that because it comes from the hospital, it's going to be safe. They need to be properly educated about this. Or maybe they have so little trust in the system that they have a fatalistic attitude and that it's just down to their fate whether or not they're exposed. And again, it's up to the employers to make sure that they have that, you know, these things are dealt with. Workers dealing with waste need to be recognised as essential workers and provided with the educational, occupational health protection, pay and status that they deserve as a vital part of the environmental health and infection prevention and control. And this includes vaccination and post-exposure prophylaxis for existing diseases. And they should be prioritised along with health workers for coronavirus vaccination if and when becomes available. And then last little point, don't forget, as of yesterday, that WHO is advising everyone in the public to wear masks. So these can be cotton ones, and should take them off without touching the mask itself. They can be stored for a few days in a paper bag, and then ideally washed with plenty of soap before reuse. And to say that I think that all of our presentations are going to be shared. If you look at my presentation, you will see a link to some very good resources on how to put on and take off PPE properly that can be shared with your teams. Thank you.
Thank you, Ruth. I think there was very comprehensive and a good indication of how things should be addressed. I'm sure there are challenges in implementation, especially with the general waste managing community. But I think important for us to sit up and take notice and see how we can implement these on the ground. I request now Ms. Yutika Puri to speak on this issue of the increasing quantities of yellow category waste, which is now overwhelming the incinerator capacity. Are there opportunities to explore alternate solutions?
Yeah, thanks, Dr. Punima. Yeah, definitely there is an increase in yellow category of waste, which ideally shouldn't be happen, because if we see the scenario with the COVID positive patients, what all items which are actually related to the yellow category of biomedical waste come out of it. In our guidelines also, like we have mentioned few items such as used mask and head cover, shoe cover, and other PPEs, disposable PPEs will go in yellow bags. Other than that, there is no anatomical waste, there is no as such body tissue, and since we don't have the exact vaccination for this COVID thing, we don't have enough like many numbers of syringes, etc. So there shouldn't be increase in specific yellow category of waste, but because of misunderstanding with respect to segregation of waste, everything is kept under the yellow colored bag or bin. That is why there is an increase. But yes, due to this only, we have already given the provision to use the hazardous waste incinerators or other industrial incinerators. For example, some pharmaceutical companies, they have their own incinerators, and they run at very high temperature, which because for biomedical waste also we need the combustion of waste at not below the 850 degrees Celsius, and it at the secondary level combustion we always ask for more than 1000 degrees Celsius. And those industrial incinerators run usually at 1200 or 1300. So they can dispose, or the biomedical waste can be disposed with the help of those incinerators, and this is the option. And if we segregate the solid waste apart from this biomedical waste, then there is a high chance to get the segregated dry or wet solid waste. So with that we can go for recycling also. So there are many options available. The only thing is to implement these things, and whatever the guidelines are saying, like with respect to the segregation, especially if the hospitals or the administrators of quarantine camps, if especially because there is a huge mixing of solid waste and yellow waste at the quarantine camps also. Hospitals, they are well aware of the things, they are doing things fine, but these quarantine centers, people sitting over there are still not very much aware of the of all good practices for segregation, and that is why there is a huge increase in overall biomedical waste generation, and they are keeping only yellow colored bag or container with them. So they are putting everything in yellow, and that is how the waste, the increase in waste is there. So, but yes, we have given alternate solution for that also to tackle the situation. This is the thing, Dr. Purnima.
Yeah, thank you, Sritika, for enlightening us about those alternate options as well. I think those are important pieces of information for us to know. May I now request Dr. Shyamala Mani to talk to us about how to address the issue of dumping of food waste from COVID-19 wards in the yellow bags, and what are the potential solutions?
Thank you, Dr. Purnima. I want to show a few slides. If I may share, can you just stop sharing this slide, because then it will be easy for me to explain. Yeah, that's right. So, for the solid waste, the biodegradable, what has been suggested even in the solid waste rules is that biomethanation followed by composting is the best method. This is the bulk generator waste for wet waste or the biodegradable waste, even at normal times. So some of the things which we have found very useful are, one is this, what is known as a closed composter, but actually it has got aeration, it's got a drum, and it's got a screw. So you can actually put the wet waste along with the inoculum and some kind of dry but biodegradable waste. What I mean is like peels of vegetables and fruits, and even part of garden waste can be put. So, and depending on the capacity and size, these are very useful, because this is taken from the La Meridian Hotel in Delhi. Of course, that comes under the NDMC area. But we are requesting these people to provide this in every hospital, and in whichever places there are some composters also in these large MRFs, which some of the municipal corporations like SDMC and EDMC have deployed, but they are all not being utilized for proper capacity, because everybody is giving mixed waste. But otherwise, we have found that the temperature is going up to almost 70-75 degrees Celsius. The retention time is, like for a 1-ton composter, the retention time is almost 27 to 28 days, which is adequate to address the problem of COVID waste. And even for a 1/2-ton composter, it is almost there for 21 days. So, except for those instantaneous composters, these are very good, and this give a good quality compost, and they also treat the biomedical part of it. And here, this is the left side, you can see this is biomethanation biphasic, developed by Professor Sharad Kale from BARC, Baba Atomic Research. This is at Tihar Jail. This is also replicable. You can put it up in many places. Here also the retention time, because it's also using aerobic and anaerobic, the retention time is sufficient. The temperature also goes up sufficiently, and because of which the COVID virus can easily be inactivated. And of course, in addition, you get biogas, and also the gas can be, of course, checked. There's no harm that we check the gas, whether there is any residue in that. The same way, the sludge can also be checked. This is another biogas plant, which is a containerized biogas plant. It has a pre-digester and a post-digester. Here also the retention time and the temperature is sufficient. And here also, this would be very, very effective in killing the COVID virus at the same time. Again, I think I would recommend the testing of the residue of the sludge and the gas. But if all hospitals and several of these large MRFs, they were to use this, this would be a very, very useful way to address the issue. This is, post biomedical, post biomethanation, you can do composting even in pits. Or here you can see that this is a method of mixing the inoculum and grinding it, and then doing the composting here. Of course, because it may be COVID based, you may have to do a little extra by covering it by tarpaulin or something. But with misting and etc., with aeration, here also the temperature goes up adequately, and this is quite adequate to treat the residue from, especially from the biomethanation plants. Here, of course, this is the garden waste. You can see even in the common facilities, like what Yuthika was talking about, incineration plants are being used and the temperature goes up quite high. But unfortunately, what we are seeing is suppose the barbers or these spas, they are sending their hair or any other waste which is coming. It first comes to these kind of dalaos. You can see there it is, this is a SDMC area, not adequate, almost, see, the person is not wearing boots, no gloves, hardly a kind of a cloth mask, and that also he put it on only after I spoke to him. Mixed waste, and the community is not addressing this issue. So you can see here, this has been sent by one of the participants whom I interacted with this morning, and this is from the Sarita Vihar area. So they have found all this coming from the WTE, waste to energy plant. So this is what I meant, that it may not be adequate to just send these kind of mixed waste to waste to energy plant, because this can create formites. Some concerns have been sent from Chennai also, and they are asking about the sewerage problems. And what I've noticed is here also, if you use a combination, especially for preventing groundwater pollution, if you use a combination of biomethanation, which has been, the Ministry of Housing and Urban Affairs in its website has given a combination of biomethanation, anaerobic and aerobic digestion, and they have given all these technologies which they feel as quite adequate to address whether it is maybe having COVID waste through the excreta or ordinary times. So they feel that only thing is we need to test and check whether the sludge and the residual water will have any, the RNA particles. Because in Italy and in some other places, yesterday I was attending one summit on webinar, and they said that some RNA particles have been found. But these are quite effective, and we feel that this may be able to address some of the issues. Even we have found that septic tanks and soak pits, they are also quite adequate, because they are having retention time, the temperature is going up, and it's actually adequate. But we need to test whether the residue, the liquid and the solid, whether it has got any particles and whether there is any transmission from this. Even the eco-SAN process in very, very remote areas and rural areas, this is also found to be quite effective, because it has temperature and as well as retention time. So we feel that by and large, use of NBS or nature-based solutions would be actually adequate to address both these problems of wet waste and the sewage waste. And this is Devnahalli. There they have actually tested it also, and this is called as an FSTP, fecal sludge treatment plant, again anaerobic digestion and aerobic, and use of sunlight and air. And they have said that they have found it very effective, and it is being able to address the issue. Cost is also less. So otherwise, other things are already addressed. So this is the best way, I would say, that COVID-19 can be addressed through use of the nature-based solutions.
Thank you, Dr. Mani, for highlighting some of these very innovative solutions. May I now address this next and last question to the other two panelists, Ms. Yutika Puri and Dr. Ramesh Kumar. This question was also asked by the participants earlier. So this is with regard to waste that is generated from salons and spas and tattoo clinics, for which can pose a threat in the COVID-19 scenario. And is this an opportunity to bring these under regulatory purview? So Ms. Yutika,
Yeah, yes.
and then I can request Dr. Ramesh Kumar to add on as well.
Yeah, Dr. Purnima. Yeah. Waste generated from salons and spas and other areas which you have mentioned here. See, this is a very, we need to understand the scope of entire biomedical waste management rules also. And, we need to understand what is exactly the biomedical waste. Okay. At the general household levels, even though we talk about the disposal of masks and gloves, how to just give a general guidance to them, like how you can dispose of your used masks and this thing. But if um, coverage of these salons and spas and tattoos and other piercing clinics, etc., I was wondering while referring this question, like what kind of waste would be there. I mean, from any hair cutting salon, some discarded hair will be there. And uh,
waxing strips, and in shaving places, little drops of blood, cotton, all those things are there, Yutika.
That is okay, ma'am. But if any item which can qualify the definition of biomedical waste, that I can consider as biomedical waste, and in that case I would really include these areas under the purview of waste management rules. But until unless we are getting general waste in our hands and we are talking about them to include in our regulatory purview, without having any study, this is a very questionable thing, that whether we should include them or not. So this is the thing. I mean, if somebody, or there is a news article, it's okay, but still we really don't feel that they need to be covered under the purview of this legal framework. If we can do some kind of study or some kind of survey from these centers, then maybe we would be in a picture to say more on this topic. But as of now, I don't think that we should say yes to inclusion of these areas into the regulatory purview, I guess.
I think I was muted. So thank you, Ms. Yutika, for sharing your thoughts on this. May I request Dr. Kumar, because I think this is still a gray area and we all have some doubts on our minds about this. So Dr. Kumar, what are your thoughts on this?
No doubt it is a basically gray area, but every municipality has a rule regulation to register this type of business under their act. As far as act is concerned, municipal act is concerned, the business related to, I am audible?
Yes, sir. Yes, you are.
Yeah, the trade business related to beauty therapy, applying cosmetics, hair dressing, tattooing. In fact, tattooing is very important, and skin piercing is also very important, because it's have some, you are penetrating their skin, and which can be a health hazard as far as their health is concerned. And under the, if these are require the health license. In the health license, what the municipality sees about whether they keep business clean, whether they're using sterile equipment, whether they are having their hand facilities in their premises, whether they are using separate seat for individual person. And in fact, then I think I am reading somewhere there is some age limit also. Under 18, you cannot do for tattooing also. And then there is also some guideline for any saloon. They keep the instruments right after every shaving or after every hair cutting. They have to keep some separate tub for this.
Yeah.
Dr. Punim, I would like to add one more point here. Like, am I audible?
Yes, you are. Yeah.
Yeah. If we are talking about for inclusion of such places into this legal framework, then we should, we should think about our other part also, other for our treatment facility operators and the existing infrastructure we have for the final disposal of waste coming out of it. In Delhi, we don't have even secured landfill with us to dispose the hazardous waste and all. So this kind of things should also be considered while finalizing such big thing. I'll definitely, if somebody or through your organization also, if there is any proposal, you may anytime submit it to the concerned ministry or concerned department. But still, there is a need to elaborate more on this aspect, and with the proper study only we can finalize such big decision on this.
Thank you. So I think I'll hand over now to Ananya. Thank you to all the panelists for having addressed all these concerns. I know there are still some unaddressed kind of areas. There are lots of questions that we can.
Can I answer this question actually regarding the parlors and the tattoo clinics? Actually, the waste generated from such centers should not be considered as biomedical waste, because in that context we have many things which will be considered as biomedical waste. See, pandemic is there and the government is testing. So unless proved otherwise, don't consider these as biomedical waste generators, because when these rules were being framed, me and Dr. Shamla Mani were there at that time in Ministry of Environment. The question had come at that time also, but these should not be coming under the ambit of the rules, the parlors or these are basically, you can say, bulk waste generators. Maximum
Exactly. Yeah.
is you can say a hazardous waste bin with that, along with the green or the blue waste bin. They can keep a hazardous waste bin for disposal of PPs. That's it.
Domestic hazardous waste. You mean
Yes.
domestic?
Yes.
Exactly, and then domestic hazardous waste can be channelized through the municipalities to their defined like the treatment centers.
But it goes to common biomedical waste only.
Yeah, it will go to the common biomedical waste only, ma'am, but it should it should qualify the definition of domestic hazardous waste. We have given items in solid waste and biomedical waste management rules both, like what is domestic hazardous waste. So wax strips and discarded hairs and etc. These things are really and not yet covered under the those definitions. So
Yeah,
without,
because I would like to bring to the knowledge that the airports now, they are giving these PPEs, especially the face shields and masks, to their passengers. So they have started keeping the domestic hazardous yellow bins. You can check with the Delhi airport also and other airports also, along with the blue and green bins in context of this pandemic.
yes, and we have another example to share. Like for example, for the disposal of used sanitary pads, this particular point is not covered under like it is, the disposal option is given under solid waste management rules, and which says like it should be just small precautions, separate storage and separate handing over the things to the municipality workers. So this is just like that. I mean. If we really want to give separate or extra precautions to these centers, then we can give some guidance to them. Otherwise simply giving the entire waste coming out of these places to the common facility operators for the disposal along with the biomedical waste would not be the justice for the waste management rules also, because these rules talks about segregation and identification of biomedical waste. Entire categorization is given in the rules, so that is also one of the concern. I mean,
thank you so much, all of the panelists, for sharing all your knowledge on this important area of waste management. I think we could have gone on for another hour, it looks like, because there's so many questions that are there. But I will turn it over to Ananya to kind of summarize and decide how we would like to pass on the questions to the panelists later.
Thank you, Dr. Purnima. These were very good and enriching discussions that we had, very comprehensive. We basically covered everything, right from the importance of PPE and disposal, the right method of disposing the PPE, as well as how to dispose each and every waste category, and several other issues which were not directly associated with biomedical waste. So we are a little behind time. So and I also see that many of the questions have been answered by the panel members, and some of them have already been discussed during this panel discussion. So I would request everyone to please note for any more queries if you have, and we would like to now basically, this is my ID, and you can write to me for any more queries, the queries that have been left out. We will definitely write back to you. We will share the responses from our individual panel members. And with this, I would like to end this webinar. But before this, I would like to thank our panel members for their kind participation and our audience for having participating in the active discussion. I would like to thank Dr. Purnima Prabhakaran for her kind guidance during organizing this webinar throughout. I'm extremely grateful to our team members, Dr. Mani, Mr. Sriram Manoharan, Subi Dogra, and Masroor Azam, for helping us and supporting us throughout in putting this event together. Thank you, everyone, and have a great evening.
Thank you, Dr. Purnima, and thank you, Ananya, and thank you, rest of the panelists, and thanks the audience for the interactive sessions, and be safe, all the COVID warriors. Thank you.
Thank you so much. Thank you, Dr. Malini, Dr. Ramesh Kumar, Yutika, Dr. Purnima, and Ananya. Thank you very much. And all the PHFI members.
Okay, thank you.
Thank you very much.
Okay,
Goodbye.
bye.
thank you, ma'am. Thank you.
Thank you all for joining us. Thank you. Bye.
Thank you, ma'am.